It looks like this book. Hello, everybody. Technology is already making this fun. My name is Nikki. I am the owner of San Diego Moms, and hopefully we are now live on our Facebook page as well. I just want to double check that, but I am so excited to be here today. Obviously the past year and a half has been very difficult for everybody, and so this event is typically done in person, and so next year we are super excited to be back. As I kind of went through the pandemic, my heart went out to women who either got pregnant during COVID, had a baby during COVID. I just can't imagine how difficult that must have been to kind of navigate everything that was, handed over to you, whether that was not having your spouse in there or not being able to have them at the appointments. It definitely just emotionally probably was a very difficult time. But nonetheless, our little bundles of joy will be here. And so it's so important to really equip yourself with the knowledge and resources that all of these amazing people here today, and definitely the healthcare workers and doctors and nurses that were there providing services to you during that difficult time as well. Thanks, to you and hands down. This event is presented by Children's Primary Care Medical Group, which they have been a great partner to us for a very long time. They're the largest pediatric primary care group in San Diego. They have over 20 offices throughout San Diego County, and we're going to hear from two of their pediatricians here today, and Dr. Mina Wasson, who will be kicking off of our presentation, is one of those. So I'm going to add her to the stream here. But just a few other quick notes. We'll be doing giveaways. You guys can kind of follow along and comment on Facebook on the main San Diego Moms page, because that's the only place we'll actually see it. So if there is a giveaway you're interested in entering to win, please comment. And Katie, who is helping me, will be posting links and more information kind of in the comments and responding to everything there. We will also answer any questions. If the speaker doesn't get to it in the presentation, we'll definitely have time for that at the end of each presentation. And we also have a really cool preview class. It's a Fit for Baby with Fit for Mom at the end. So I have my yoga pants on already. I think that's the one good thing from the pandemic, is that workout clothes have become acceptable to wear. So get ready to close out the day with that. That should be a lot of fun. All right, so I'm going to add Dr. Mina Wasson here. How are you?
Hi, Nikki. Thank you so much for the introduction.
I can't hear you.
Can you hear me okay?
Unmute your mic. Let's see here.
I believe I'm unmuted.
Can you hear me?
I can hear you. Yeah.
I don't hear you. But maybe it's because, are you there?
Can you hear me now?
There we go. Sorry, it was me. Technical difficulties, but it was self-inflicted. Anyways, thank you so much for your time, and thanks for being here today. You are a pediatrician over at Children's Primary Care Medical Group in Carmel Valley, originally from Chicago. You have 2 daughters and a husband here, and you guys love spending some time outside, which I'm sure it's a little bit easier here than out in Chicago.
Definitely.
Yay! Well, we are so excited to have you here today, and I won't talk anymore because I think everybody's here to definitely hear from you. And you're going to be sharing about the first 2 weeks and kind of what to expect when you bring your baby home. So I will hand it over to you and kind of remove myself and everybody give her a good welcome.
Thank you so much. So as Nikki mentioned, I'm one of the pediatricians here at Children's Primary Care Medical Group, and I'll be sharing a little bit on kind of the first 2 weeks of life. So let me share my screen here. All right, can you all hear me and see me? I hope you can. So first 2 weeks of life, the main things we hope to kind of review in this presentation is just what to expect when you're in the hospital right after delivery. The 3 or 4 things that your baby will do, which is eat, sleep, pee, and poop. And do a quick review of some normal newborn findings, which you may appreciate when you get home. We'll end with a little bit about what things that you would want to contact your pediatrician with. So you're at the hospital and congratulations, you've delivered. Hopefully it's a boy, girl, or everything in between. At the hospital, the main purpose is basically preventative care. So one of the first things that you'll notice will happen to your newborn baby is that they'll be given a vitamin K shot. And this is something that they get to prevent something called hemorrhagic disease of the newborn. Babies don't have adequate amounts of vitamin K, which help in clotting. So after all the rigors of delivery, we don't want any sort of bleeding problems. So the first thing that they'll get is a shot in the thigh of vitamin K. And you'll notice that your OB will also put some ointment in their eyes, and that ointment will be an antibiotic that prevents the eyes from infection. A long time ago, eye infections from vaginal deliveries used to cause blindness in children. And ever since we started applying them immediately after birth, we don't have any problems like that anymore. The next thing that you may notice the hospital provides you is offering you the hepatitis B vaccine. Not a lot of people know what hepatitis B is, but it is an infection of the liver. And a normal liver looks something like this. It's smooth and beautifully clean. But a liver that could be infected with a virus called hepatitis B can look something like this. And you would go from chronic hepatitis, which is all the way over to the left, and progress on to something called cirrhosis, and it can even cause cancer, so hepatocellular carcinoma. Um, Hepatitis B is very dangerous. It can be life-threatening, so we want to eradicate it. And thankfully, the reason why most of you may never have heard about it is because we have such good vaccination early on in the hospital. If you look at this map from the CDC, you could see that the majority of the world has moderate to high levels of hepatitis B infection. When you get hepatitis B as a newborn, it actually is chronic and lifelong, and it's very difficult to treat. So outside of the United States, Canada, and Mexico, and parts of Southern America, it's fairly rampant throughout the world. So we do like to get our babies vaccinated with hepatitis B early on to keep our country safe. The other screening tests that you'll notice in the hospital are a hearing screen. And this just makes sure that your baby is able to hear you. They'll check a jaundice level, which is typically over the skin, making sure that your baby is not too yellow, which can be harmful to their brain. They'll check oxygen levels of smaller babies in their car seat so that when you're taking your baby home, there's no risk for poor oxygenation. And they'll do a little heel poke. And these little circles on the bottom of the screen are blood samples that are sent for all babies born in hospitals to check for a few blood diseases. So California newborn screens, it's kind of changed over the last 40 years or so, but originally it was meant to diagnose kind of diseases that can suddenly harm babies in the first few weeks of life. Over time, we've added a few more diseases to that plate, and now we have 50 or so diseases that we can diagnose just from a heel blood sample, and all of these are usually reviewed with you at the first or second month well visit to make sure there's nothing concerning going on with your baby. So you've done all those things. Hearing is normal, jaundice is normal. We have no problems with oxygenation. The newborn screen is sent, so you're homeward bound. And that alone, a lot of work. So we're pretty excited about that. But at home, it can be fairly exhausting. So your baby does only a few things at the first 2 weeks of life. They eat, sleep, poop, and then they do it all over again. And after a certain amount of time, it can really feel like Groundhog's Day. Sometimes it can even feel like those next 14 uh, days are just lasting forever. So here's a few things that I want you to remember. Feedings. We feed every hour, every 2 hours, every 3 hours. It kind of depends on your baby. But there's a couple ways you feed. You can breastfeed, you can bottle feed. Um, my colleague, Dr. Nodin, will talk a little bit more about breastfeeding. But in general, just keep in mind that whatever you do, baby that is fed is best. Weight checks are pretty important, and we'll see you for a few visits in the first couple weeks of life. But by 2 weeks, we basically want to know that, hey, you're not down more than 10% of your birth weight. And in general, we want you to gain somewhere from half an ounce to an ounce per day. By 2 weeks of life, we want you to be back at your birth weight. So that's the general thing about feedings and weight checks. Sleeping. Um, in the first, you will not sleep well, and everybody who tells you to sleep when your baby sleeps, um, this is the cartoon that I have for them. It's very hard to sleep when your baby sleeps. So just get a lot of sleep right now, and make sure that you guys take turns watching the baby. Safe sleep is the main important part that I want to emphasize. And when you look on social media, you'll look on Instagram, and they'll have all these beautiful cribs with chandeliers and blankets and pillows and bumpers and these stuffed animals, and basically want to reiterate that this is not safe. Um, Hopefully you can also find these beautiful, clean, safe spaces, equally Instagrammable, I hope. But I just want to emphasize on your back with nothing else in the crib, no blankets, no pillows. So no and yes for these, to make sure that your baby is the safest when he's sleeping. The reason we care about safe sleep is something called sudden infant death syndrome. We call that SIDS. And this is a very busy slide, so I just want you to appreciate two things. The bar graph shows the rate of sudden infant death over time. From 1988 to 2006, which is where this is tracking, you can see that there's a decreased incidence of sudden infant death syndrome. That decrease kind of starts around when the American Academy of Pediatrics started this Back to Sleep campaign, or the Safe Sleeping campaign. And as you can see, the longer we've been promoting sleeping on your back, the lower the rate of sudden infant death in children. So let's move on to wet diapers. How many wet diapers should I have in the first 2 weeks of life? So if you look at this graph, you'll see on day 1, we want 1 wet diaper. On day 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. And after 6 days of life, we want 6 plus wet diapers. So it should be fairly easy to remember, how many wet diapers should I expect? And that is how you track, is my baby feeding appropriately? Are they dehydrated? Are they getting enough milk? So 1 wet diaper for every day of life, up to a week. We don't want it to go much longer than that. Otherwise, you and I would be peeing quite a bit. Bowel movements. There's some changes in the bowel movements in the first few days of life. So very first poop will look something like this. It's very thick and black and tarry, and we call that meconium. It then progresses to transitional stools, so it looks a little bit like greenish. And then it finally becomes this beautiful yellow seedy stool. Some people liken it to mustard or Dijon mustard. It has those little seeds. So let's quickly review some normal newborn rashes, because the things that parents appreciate more is how their children's skin looks. And there's a lot of changes over the first 2 weeks that you should appreciate. The very first thing that you'll appreciate is your baby comes out and there's all this stuff on their head. So these two pictures, they look very similar, but one is Fernix and one is cottage cheese. They look kind of similar to each other. The other thing that you may notice is right over the eyes and right over the center of their forehead, you'll see kind of this red rash, and we call these angel kisses. And it's kind of a nice cutesy name because it's nice and cutesy, it's not dangerous. And on the back of the nape of the neck, you'll see something called a stork bite. And we show that here with a stork because that's how your baby was delivered to you. So these are all normal. This looks like a very concerning rash, almost looks like pimples. These happen somewhere after you leave the hospital and then subside at about 2 weeks. But we call this rash erythema toxicum. We call that ET for short. And this is also a very normal newborn rash, usually subsides by about 2 weeks of life. Finally, at about a week of life, you'll also appreciate that your baby's skin is peeling. And that's not because your house is dry or there's any concerns, but this is just normal newborn peeling. You want that skin to peel off, and then underneath you'll have new beautiful baby skin. So no need to worry about skin peeling. And then progressing on, this is a common skin finding. We call this cradle cap, but some people call it cradle crap. Because it's pretty annoying. There's this thick yellow scale over the forehead, over the eyebrows, over the scalp. But thankfully can be treated pretty easily. We throw a little bit of Selsun Blue on there, some antifungal shampoo, and it'll get rid of that pretty quickly. Most kids outgrow it at about 6 to 8 weeks. And then the most notable finding is that towards a month of life, you may start appreciating some neonatal acne. And all of these do resolve over time, so nothing too much to worry about, even though visually they can be quite alarming. So when to call your pediatrician? We always are worried if your baby has a fever. Fever is 100.4 Fahrenheit or higher. We recommend those temperatures to always be rectal because they are the most reliable. If your baby is not feeding, not having the appropriate number of wet diapers per day of life, or they're not gaining good weight, we want you to call. If they have worsening jaundice, that you left the hospital, but now they look more and more yellow, we want you to call. And if you have any funny colored stools, it's not black after any sort of black stools, white stools, gray stools, red stools, things that are not in our color palette of stools we care about. And then if someone tries to Instagram your crib, care about that too. So don't do that. And the whole thing is a marathon. It's not a sprint. So it's not about trying to do everything you can possibly do in the first 2 weeks, because this is marathon for a long time. And if you don't remember how to do a marathon, just remember right foot, left foot, take it a day at a time. Here's a little bit of information about us. And if you'd like to call us for any of your pediatric needs, you can reach us at this number.
Wow, thank you so much. That was amazing. If anybody has any questions, feel free to drop it in the comments. Can you hear me okay? Yeah. Do you hear me? Yeah. I have just kind of a random question because I saw that you said you could treat kind of Selsun Blue. Are there any products, like when you're trying to maybe self-soothe or like correct something at home with a rash or something like that to stay away from? Is there anything that throws up a big red flag?
Yeah, we would always prefer that you call us first.
Yeah, first. Yeah, I was just curious when you.
Yeah. So we always want you to call us first, but in the first month of life, we actually don't recommend any products on the baby's skin. The baby's skin is very sensitive, and we don't know which babies will be more sensitive than others. So the most we want is butt cream in the diaper area, maybe some Vaseline, but that's about it. Anything else, please touch base with your pediatrician and be happy to direct you to some safe over-the-counter options.
Nice. And then I know obviously the focus is on the baby, keep the baby alive. First 2 weeks are very important.
Yes.
There's a lot of stuff going on. Is there any advice that you have for moms? I mean, it's a very difficult time, and I think the emotional, and we do have a question here, but is there any emotional advice that you can give to the mom? Obviously, I think I had to laugh when you said sleep with the baby sleeping. That's definitely a false, whoever says that needs to stop saying that. But any other advice you can give for self-care or just checking in? And
yeah, so I was a pediatrician for 4 or 5 years before I had children, and I could scream at myself for the things that I had said to parents before I became a parent myself. You really need to be nice to yourself. Even as a pediatrician, I felt like I didn't know what I was doing. So I have so much, I really feel for everybody. As a first-time mom, it's so hard. You really just need to be gracious and be kind to yourself, because it's a hard time for anybody and everyone.
There really is. And it looks like we do have one question here. My baby currently has thrush, and I've treated with nystatin, but it doesn't seem to be going away. Any tips?
Yeah, so thrush is really hard because if you're breastfeeding or if you're bottle feeding, it transfers. It's a fungal infection that can transfer from the baby's mouth to anything else that the baby's mouth touches. So sometimes it can be very resilient because the breast can have thrush and you guys just keep passing it back and forth to each other, or the bottle nipples aren't being completely sterilized and the thrush is kind of staying on the nipples. So I would recommend get some over-the-counter Lotrimin or antifungal cream, put a little bit on your nipples if you're breastfeeding. Otherwise, do kind of a hot boil of all of the nipples or all the pacifiers that your baby uses, and that could help just kind of eradicate it a little more quickly.
This might be a dumb question. I 5 years from breastfeeding, 5 years ago. But can you put that cream on and then is there a time you have to wait before you can breastfeed, or?
Yeah, that's a great question. There's something called Newman's nipple ointment. It's the godsend of all breastfeeding moms. It's actually a combination of steroid cream, antibiotic cream, and fungal cream. So it's basically the kitchen sink being thrown at you to prevent you from getting any infection possible. But I usually recommend putting it on right after breastfeeding. So it's the longest duration of time from when you'll breastfeed again. If there's a lot of ointment still on there, I do just gently wipe it off, but it wouldn't be dangerous because those are the same medicines that are going in the mouth for the baby when they're infected.
Okay, perfect.
Yeah.
Well, amazing. Well, thank you so much. And we will be sharing all this information and kind of putting it into a post as well, so you can kind of skim through, refer back to it. And we'll be obviously also posting this video on our website after. So thank you so much for your time and your expertise. And thank you. I appreciate it.
Thank you for having me. Have a good rest of your day. Take care, guys.
All right. All right. Well, that was pretty amazing. It's so funny how much you forget immediately, or maybe it's just mom brain, one of the two. But next up, we have Dr. Kimmy Haas, and he is the co-founder of the Super Dentist and one of my favorite people.
Oh, hello. Thank you, Nikki. How are you doing?
Good. How are you?
Very well, thanks. Nice
Good. Thank you so much for being here. I'm so excited to hear kind of what you have to say, but I just want to say my daughter had her first appointment there at the Super Dentist, and the experience was hands down just amazing. We had tried to go to a dentist 2 years prior to that, and I'm a horrible mother, and I hadn't taken her since then because it was just, I think you guys just really have something so special there, and you guys truly care. So we're so honored to have you.
Feedback I can hear from my mom. I appreciate it.
No, absolutely. And I'll let you kind of share a little bit more about your background and who you are. But today we're going to be talking about the 8 ways to prevent cavities and crooked teeth, which I think last year I just learned so much. And even just with some of the other events that we've had, there's just so much that you could do from day one. And so I think it's it's not addressed enough. I think not even just crooked teeth or cavity, but I mean, from the oral health, from pregnancy, all of the stuff that we've had you share. So I'm so excited to hear about this.
Well, thanks. No, you're right. I think people think the mouth is all about just cavities, maybe the dentist, that's true. I mean, historically, we're like cavity fixers, right? Unfortunately, we don't really connect the oral health to physical health, mental health, pregnancy health, airway health, sleep, oral development, the way we look and the way we feel confidence. So, that's a discussion for another time, but I'm really happy
I know,
to be
sorry,
here
but
today.
I was just
No, that's true. I'm really glad that you brought it up, and thank you so much. So with that, I'll get started. As Nikki said, my name is Dr. Kami Haas. I'm an orthodontist and dentofacial orthopedist. My wife is a pediatric dentist, and we founded our practice, the Super Dentist, 25 years ago. In fact, next year, we're going to be celebrating our 25th year anniversary. When I was growing up myself, my mouth was just a mess. I had a lot of cavities, more than I would be willing to admit. And my mouth was so small, I had 4 of my permanent teeth removed when I had braces the first time for 3 years when I was a kid. And then I got braces again a second time during my orthodontic residency. So I'm here to tell you that if it were all genetics, which a lot of people think, my son who's 9 now, he'd be out of luck and he'd have a full mouth of cavities and crooked teeth, but he doesn't have any cavity. And his mouth has grown ideally. He has enough room for all of his permanent teeth, and his bite is as perfect as it can be. So my wife and I have done several things to make sure he grows with a healthy mouth, and I'm going to share some of those with you today. I'm going to share my screen now. So I know the previous colleague of mine, she already mentioned breastfeeding, and I know following me also, we're going to get into breastfeeding in depth. So I'm not going to discuss a lot of that, but I'm going to really discuss the benefit of breastfeeding to oral health. Now, I know it's a complicated decision. Not everybody can breastfeed, but if you can do it even for a limited time or part-time, the benefits to your baby's oral health and development is profound. So these are some of the things, again, my colleague, I'm sure, is going to discuss later. But one of the things that I do want to discuss is that breastfeeding, the milk itself, the breast milk has the ideal nutrients for the developing mouth. It has just the right amount of sugar and the fat. It also introduces the mouth with new microbes and the prebiotics, which is the food for the new seeded microbiome. And also introduces the mouth and the baby to with antibodies. So it really gives a baby a crash course into good microbes and bad microbes. Also, the sucking action teaches the baby to breathe through the nose, which nose breathing is so critical for so many reasons. But when it comes to oral development, it keeps the mouth more moisture. It makes the jaw growth better. I'll discuss that a little bit later. It also stimulates the healthy growth of the palate. Your palate, the roof of your mouth, is also the floor of your nose. So when you breastfeed, the baby's tongue sits against the palate and it allows the palate to grow healthier. So that reduces later crowding. It makes the teeth erupt better. It reduces airway issues, so the baby will sleep better and potentially prevent sleep apnea and many other potentially dangerous issues. Can prevent colic and reflux. So breastfeeding has many oral health benefits in addition to physical health benefits. Now, if you haven't breastfed or you can't breastfeed for some reason, don't worry. There's a lot of other things they can do to keep your baby healthy, and I'm going to discuss some of those today. The second one is weaning off your baby from night feeding. Now, baby teeth in general, the enamel on baby teeth is thinner on baby teeth than it is on the permanent teeth. And the pulp is relatively larger, so cavities can cause damage quicker and they can reach the nerves quicker. So when babies' teeth start coming in, which again, that's a big range. Some babies start getting the baby teeth around 4 months of age, some not until like 8 or 10 months, but the average about 6 months, which is right after kids can typically sleep through the night without being fed, which is usually around 5 months of age and or 15 pounds. Obviously, you need to check with your pediatrician for your specific baby. So right after they're physically able to sleep through the night, then you want to wean them off of night feeding. And you can obviously do your research and find out what method works best for you. And as an added bonus, not only it will less likely to have cavities, but the baby will sleep better through the night because you've removed the sleep feeding association. The next one is the oral habits. Now, a lot of kids just are born with a thumb in their mouth, and that's a very common oral habit. But sometimes also parents introduce pacifiers, or they haven't been able to breastfeed, so they have bottles. So if your baby is thumb sucking, using a pacifier, or has a doing bottle feeding, you definitely want to monitor the growth of the mouth. Make sure the pediatric dentist is involved, because the breast shape itself to the mouth, but the mouth shape itself around the thumb and around the pacifier. So it literally, when you suck your thumb, the mouth grows around the thumb. So it's really important that you check with the pediatric dentist to make sure the mouth is growing correctly, because an unusually formed mouth can interfere with speech, with airway, the jaws can develop a cross bite. All sorts of issues can arise from thumb sucking. We want to, if your baby is doing some thumb sucking, you want to check with your pediatric dentist and stop those habits as early as possible. Every kid is a little bit different, so definitely want to check with your doctor on that. The next one is the toothbrush. Now, I've had over the years people say, well, Dr. Oz, a brush is a brush, right? Well, really far from it. Brushes come in all sorts of ways and technologies. They look beautiful to make it exciting for the kids to use it. Because remember, baby kids throughout their life, they're brush for over 2,000 hours. So it's really important that they develop a good association with their brushing and with oral health and oral care in general. So make sure you involve them in picking out a great toothbrush that they love, first of all. But also the bristles are so critical, because that's the part that the bristles are the part that you clean your teeth with. You want to make sure that the bristles are only soft or ultra soft. Never use a hard nylon or charcoal toothbrushes, because those brushes are too aggressive and too abrasive for the teeth. This can scratch the enamel, which then it can absorb more plaque and bacteria. And also damaged teeth are more sensitive over time, and tooth sensitivity is a huge problem right now in adults. So, and then manual toothbrushes or electric toothbrushes are both fine. So whatever your child likes, those are the ones that they should choose. Now, how do you actually brush? You may be surprised to hear that 5-year-olds only brush 25% of their teeth, and even 11-year-olds only brush 50% of their teeth. And of course, we always joke around, and when patients ask, which teeth I should brush, we say, well, brush only the ones you want to keep, right? So it's really important that brushing, especially at the young age, becomes a family event. You really need to monitor, supervise, even brush for your child for many, many years before they're good. They form good habits and they can brush on their own. Make it a game. Come up, brush together. One of the things you can do is buy them a musical toothbrush, because research shows that kids brush 73% longer with musical toothbrushes, but they also have more fun and they build positive association with their brushing, which is really the key thing as you get older. Okay, so as far as oral care products, probably the most important or the most common questions I've been asked over the years is about toothpaste. Dr. Haas, is fluoride safe? What kind of toothpaste do I want to use for my child? Well, that topic is such a big topic. I could probably spend 2 hours discussing all the ingredients in toothpaste, what's safe, what's effective, what's good and bad. But for today's discussion, suffice it to say, I'll just talk about fluoride, because such a big controversy about fluoride. So fluoride is an ingredient. It's the only compound that's been approved for FDA to remineralize teeth that's anti-cavity in US. Although in Japan, there's another ingredient called hydroxyapatite that's been used for over 30 years. In Canada, it's been approved for anti-cavity for many, many years. And for younger kids, even though fluoride works the way it works, when you put anything in your mouth, I'm just going to talk about how cavities are formed. When you put food in your mouth, almost any food, but sugar in particular and acidic foods, the pH of your mouth drops from neutral, which is about 7, to about 5.5. And at that 5.5, some of the enamel mineral called hydroxyapatite, it melts or it dissolves away from the enamel into saliva. And then when you stop eating, the saliva buffers that pH back to about 7, and that hydroxyapatite gets redeposited into the teeth. Now, if you eat too much sugar, or if you eat too frequently, there is more demineralization of this hydroxyapatite from your enamel into teeth, and there's not enough time for the body to put this back. And then, so you get a cavity, there you get a hole in the tooth that we cause a cavity. And now, NASA invented this hydroxyapatite as an ingredient in toothpaste many, many years ago. And so that's one of my favorite ingredients to use on younger children because it has many of the benefits of fluoride. In fact, it has its own benefits, like it can reduce sensitivity and it can even, whiten teeth over time naturally. But it also helps with remineralization of teeth. But it doesn't have many of the potential side effects of fluoride on younger children. Now, if you're an older person that has a history of cavities and a daily soda habit, then fluoride is really effective in remineralization of teeth as well. Now, this one, limit the sweets, is easier said than done. I'm a dad of a 9-year-old. My son has a sweet tooth. His parents may be dentists, but he's a kid after all. Truth be told, I have a little bit of a sweet tooth myself. So the key word when it comes to this is moderation. Again, we want to limit the amount of sugar and we want to limit the amounts of sugar, the duration or the frequency of sugar intake. Now, I don't know if you know, but as a society, we individually, in average, we eat more than 150 pounds of sugar every year. It's more than an average weight of a person. So again, it's when it comes to moderation, if you're gonna give any sweets to your children, make sure it's in one setting and it's not too frequently, and avoid candies or sweets that can stick to teeth or they're so hard that they can potentially break the teeth. And the last thing, I know I kind of mentioned this a little bit earlier, but breathing through the nose. Now, this is such an important thing that I think a lot of people don't realize how important it is. But unless your child is severely congested and temporarily congested, like they have a cold, or they're exercising really hard, they should be breathing through their nose. Mouth breathing causes a lot of problems. It dries the mouth. It keeps the teeth apart from each other, so the teeth start over erupting. It can cause a long face issues. It can cause crowding. It can cause a gummy smile. And so, and nose breathing just so much more. It filters the air. It keeps the CO2 and oxygen levels more level. Just has many other benefits. So make sure that if your child, you watch them, they're watching TV or they're sleeping or they're reading a book and they have their mouth open, that's not normal if it's happening consistently. So make sure you take your child to pediatric dentist or a pediatrician and get that addressed as early as possible, because especially those first few months and years, your child's brain is exploding and growing at a rapid rate, and they can't afford any issues with oxygen intake, especially during sleep when the muscles relax and people usually have more breathing issues. Now, again, those are some of the things that my wife and I have done to make sure that our child grows up healthy, and I hope that helps with your family too. Again, the Super Dentist, we have several locations around the county in San Diego. We're expanding out to other regions as well. Here's our phone number if you need to contact us. And of course, I'm available if you have any questions as well.
Yay. Wow, that was amazing. Thank you so much.
Thank you. Thanks so much, Nikki.
No, we do have one question in the comments. It looks like here. She said, is there a certain type of pacifier that's better than the other? Or is it just a hard no on the pacifiers? Because I know it's very difficult.
I mean, there are probably, I understand. I'm a parent, so just like my previous colleague that said, until she was a parent, it was easier to preach, right? I understand. Sometimes even when my own baby was crying, like when it was 4 months, I'm like, should I give him a pacifier? But I kind of, I didn't. I resisted it. If you must give a pacifier, there are some pacifiers that are better than the others. You really need to discuss it with your pediatric dentist. But I would at least try to stop it past age 6 months. But if possible, avoid pacifiers and bottles altogether.
Just because if you start it, honestly, it's more hard. I had to get a Build-A-Bear, and we put the pacifier inside the Build-A-Bear, and she had to make the choice. It was very, I was pretty proud of myself for this whole moment. But
I know. Over the years, I've had so many stories of parents telling me how they've been able to take away the pacifier. It's not an easy thing, I know for sure.
Yeah, it's definitely just one of those necessary and not necessary evils, I think, that causes.
I get it.
In lots of ways. But why don't you tell us a little bit about we talked about toothbrushes, and we have a few super toothbrushes that we're giving away in our kind of VIP swag bag, which is one of our giveaways. So anybody that comments or kind of interacts, why don't you tell us a little bit about that, and then we will say that.
Yeah, so again, there's a big difference between a toothbrush and a toothbrush, right? From the way they're made. The association that they build with kids is critical, right? Because many of us don't have good oral health because we had bad experiences either going to the dentist or we didn't like brushing and flossing, especially flossing, something. If you ask a dentist, they tell you that's the one thing that their patients exaggerate the most about is how much they floss. So we've come up with really wonderful, playful, but also safe and effective oral care products in general to make sure that our children love and enjoy taking care of their mouth, and they grow up building positive associations while making sure that they have safe ingredients, because these ingredients can be absorbed through the mouth, right, through the mucosa. You can swallow it. Very, very common for kids to swallow things. So you want to make sure that the oral care products that you use for kids are safe, effective, and playful.
Amazing. Well, thank you so much for your time. We've dropped a few links and more information in the comments on how to reach out to you and the super dentist. And as a mom, and I will tell you, hands down, you guys are one of the best, and I'm so grateful for you and your time.
That means a lot. Really appreciate it. Thank you very much.
Thank you. Have a great day.
You too.
All right. Gosh, so much information to take in, and there's so much to learn. But we are kind of sticking on schedule here, so we're going to go right to our next speaker, which is Dr. Veronica Naughton from Children's Primary Care Medical Group over in Vista. Hi, how are you?
I'm good. Just
good.
trying to figure out what I'm doing here with
You're good. I see your
my screen sharing.
You're good. You're good. It will be up here momentarily. It will come off. But thank you so much for being here. And you're going to be sharing sharing on breastfeeding, which for me was a very challenging aspect of becoming a mom. And we're so grateful for you sharing your knowledge and expertise.
Excellent.
All right, I'm going to hop off here.
Well, thank you for having me. And just, I guess I would tell you just a tiny little bit about myself. I do have two boys. They're quite grown. One is 23 and one is 19. And my breastfeeding experiences with both of them are different. So breastfeeding can be individual. And so just because you learn it once, you may have to learn it again with each child. That was the lesson I learned so long ago. I wanted to kind of start with the AAP policy statement. The AAP is the American Academy of Pediatrics. This is what our governing body, the pediatricians who are in this group, they study all kinds of things related to overall health. And so when we talk about the AAP policy statements, these are things that pediatricians across the country have studied and have thought to be best practices. So for the American Academy of Pediatrics, they do recommend that you don't give water, juice, or solids in the first 6 months of life. Think about initiating iron supplements really only if your pediatrician recommends it. We want you to include iron-rich foods or supplements after 6 months of age. We want you to supplement with the vitamin D daily and provide fluoride after 6 months if the household water supply is deficient. And I'm glad that Dr. Haas actually talked about this, because I find also the fluoride, it's been confusing and it changes every year or every couple of years. So always talk to your pediatrician or your pediatric dentist when you're trying to figure out what to do about fluoride. That's the policy statements. But for you, I just want you to think about, what are your personal goals? We want to help you meet your personal goals, and there is no right or wrong. So you can do whatever feels right for you for breastfeeding. For some people, they just want to try it a day. And I actually do recommend even 1 or 2 days of breastfeeding can be beneficial to your baby, because that's what you're giving your baby as your very, very first food intake. When babies, Dr. Watson talked about the meconium stools that are coming out. The meconium is like I think it's a place filler. So that all of that meconium has to come out, and then digestion begins. So the very first thing that you give your baby is important. Could be breastfeeding, and I really would encourage you to try it if at all possible. Maybe you just want to do it for a month. A month is still good. That gives you the very first month of life. Some people just want to do it for 6 months. That's their goal, because at 6 months, you're going to transition to more solid foods. So you get the first 6 months of the baby's life are absolutely the most critical for baby nutrition. And in the second 6 months, we are focusing more on some solid foods. But that can be a very acceptable goal. Some people say, yep, 12 months, I'm going to do what the AP recommends. And some people really, frankly, love it so much they want to even go further. The best advice that I ever got for when it is time to stop breastfeeding is really based on when you're ready to stop and when your baby is ready to stop. So every baby's different. And so you just have to go with it. My first child, I was going to definitely just nurse for 1 year, and we didn't stop till he was 2. So for the second baby, I said, well, we're definitely going to do 2, and he stopped at 1 year. So there has to be some flexibility in all of this, but I do want you to do kind of what feels right for you and what works with your baby. And there are goals that you can work on with your family and with your pediatrician to make sure your baby is healthy and grows up strong. So how do you get started? One of the things is once you kind of sort out for yourself, well, I'm going to try it. I want to at least try it. Make a plan. Make sure you discuss it with your obstetrician and your pediatrician. In the very first that very first hour, they talk about the golden hour, and it really is true. Babies are born with an intense instinct to breastfeed. So you really want to get them onto the breast in that first hour. And every hospital across San Diego is aware of this. And so all of your postpartum nurses are very going to want to get that baby onto the breast in that first hour because it really is an important hour. The colostrum is it's the very first food that comes out of your breast. So it doesn't look the same as regular milk or like regular breast milk. And it has proteins and probiotics and antibodies and a lot of things that are very beneficial. And the colostrum is there for about the first 2 to 3 days. So your milk doesn't come in for just a little bit. So, and there will be a transition of when your milk actually comes in. The colostrum is still very important. And some people get frustrated. They feel like I'm not feeding my baby real milk, but that is not true. It really is a valid and important nutritional piece of what you need to give your baby. So unless there's a compelling reason to add any other supplement, the colostrum actually works for the first 2 or 3 days. After 2 or 3 days, the actual milk will come in and it'll change color. It'll look more like what you think of milk. That's kind of a common concern for a lot of moms. Will I have enough milk? I think one of the things that I've noticed with a lot of moms is they like to give, the idea of giving a formula in a bottle is very appealing because the bottle comes with a measurement. So you can tell exactly how much milk your baby's getting at every feeding. And that can be very comforting for new moms. Breasts don't come with any measurement. So it's hard to say, like, did my baby get enough of that feeding? How do we know? Well, this is why those early pediatric visits are so critical. The schedule has totally changed. A lot of newborn books or care books actually state that the first pediatric appointment should be at 2 weeks, but we know that that is not the right time. We need to get that pediatric appointment within 2 to 3 days after you discharge from the hospital so that we can monitor the baby's weight. And that's why that first appointment is important. In order for you to have enough milk, we need you to sleep, we need you to eat, we need you to drink. Drinking water, the mother's tea, all of that kind of stuff will help to make sure that you get enough nutrition and that your body produces enough milk. Naturally, breastfeeding, new moms actually will naturally produce milk. It really is not usually a problem with the moms. We just have to kind of work with you a little bit. There is a concern for, this is why some moms get concerned about, do I have enough milk, is because if jaundice comes in, and we do monitor that very closely now, it'll be monitored in the hospital. It's one of the early tests that get done before you leave the hospital. It is a concern, but we will guide you through this whole process. I think Dr. Misson talked about our 10% weight loss is a concern. That's kind of been that's been the mark. Like we know that babies are born with extra fluid so they can get through the birth canal. So we know that it's extra water weight. Babies will lose that weight in the first week of life, and it's fine for that baby to lose a little bit of weight. 10% is when we have to start thinking about, well, how much more support do we need to give you to make sure that you're going to be breastfeeding adequately? So that's another reason why seeing your pediatrician in that early time is important. Well, what happens if you're still feeling like it's not working? Lactation consultation, that is a new thing. That was not such a force, 25 years ago when my kids were first being born. But lactation consultation and the growth and support of lactation has been huge. We now know that almost all of the health plans cover it. So because they see the benefits of breastfeeding and they want all of our babies to breastfeed for as long as your personal goals are there. You will most likely get a lactation consultation in the hospital. So you'll get it as an inpatient. You can also get it outpatient. And the reason I say this is because sometimes I have a lot of moms who kind of, the first couple of feedings seems like it's going well and they feel like it's good, but then they get out home and there's new struggles. So don't be shy about getting a lactation consultation. Throughout our offices at CPCMG, our goal is to have a lactation consultant in almost every office. We have kind of met that goal now with having regional lactation specialists, but more and more of our pediatricians are actually certified as lactation specialists. So we have that available for you. And I do think it's important to work with pediatricians who want to help support your lactation goals. So what do you need to do? There's breastfeeding positions. I remember years ago, my sister-in-law coined the term around the world breastfeeding. It is important when you're breastfeeding to breastfeed in different positions so that at every different position you're emptying a different part of the breast. You can see on the left, there's a picture of the baby newborn with what your breast actually looks like. Those little finger-like projections are what holds the milk, and they are finger-like projections, and they fill up like sausages. So when you're not lactating, your breasts are composed of mostly fat tissue or adipose tissue, which is soft. As the milk fills that breast, all of those finger-like sausage projections will fill. And it can fill to a point where your breast is literally rock hard. And we don't want to get you to that point because then you would have, that's it, engorgement situation. And that can lead to complications for mom. So we want to make sure that you don't end up with a breast infection or what we call mastitis. The latch is the most important thing. On the left side of that picture, you see the baby's face is really smashed into the mama's breast. To get a good latch is how you're going to be successful with breastfeeding. And I think sometimes what happens is babies, when they're on the mom's breast, they tend to want to nurse strictly on the mom's nipple. And when that happens, that can cause more damage to the mom's nipple, and it can lead to ineffective breastfeeding. So we want to really help you to get that latch so that it's appropriate and you're getting a deep latch so the baby is drawing the milk from the deep part of the breast, and that's going to cause the full milk letdown and the milk to come through. So that is kind of mission critical for what you're going to do and how you're going to do it. And I find when you're expecting a baby, it's very difficult to look at these lactation pictures and understand what it's supposed to feel like or what you're supposed to do. But in the first 2 weeks of life, with support, we can get your baby to breastfeed. And it's really something we love to do to help you. So just want to throw in a little bit about how sometimes dads or your partner feels like, well, I don't have a role here. I can't breastfeed. But that's actually not entirely true. There's a lot of things that your partner can do to help you. helping you to support the baby, helping with the latch to make sure that latch is appropriate. So the pillows and getting the baby, putting yourself into a comfortable position will help all of that happen. I think sometimes with when we're breastfeeding, moms want to use the breast as like a third arm, and it's not. We want to, instead of moving your breast to the baby, we need to move the baby to you. And so I like this photo of the dad kind of helping that mom, helping her to get that baby to the breast and in the right position so that the baby can have a good latch and can really get an effective breastfeeding. If your partner is questioning why you're breastfeeding at all, we need to have that discussion with your baby's father or partner so that we make sure that everybody is on the same page. And that way we can get everything, we can help you to reach your goals. It's frustrating, I think, for moms when the breastfeeding doesn't go well because they feel disappointment sometimes, but that's where working with your pediatrician, we were there to help support you to reach your goals. And this is a team effort. So your team includes everybody in your extended family, your village, if you will, to say, your partner, your support group, your doula, your OB, your pediatrician, grandparents that are available, and sometimes even the neighbors. Depending on what your village is, you define your own village for who's going to help you. But we're all here to help you to get to where you need to be.
Amazing.
So, this is our final slide. So there you have it.
Yay. And we posted all of this information in the comments as well. Just to kind of wrap up here, you are at pediatrician at the Vista location for Children's Primary Care Medical Group. And that was so much great information. I know breastfeeding for me personally was very difficult and latching. So I really loved that last slide where you're kind of talking about getting your partner involved. I think I wish I had that information. So amazing. And it looks like we did have a question or two in the comments, but to kind of push along just in our schedule, we will kind of go forward, but we will definitely reply individually in here. And I will circle, unless maybe it's a quick answer, we'll do it. Is a mom currently breastfeeding? How can I stop my baby from painfully pulling away from the nipple?
So when a baby is latched, you can't just pop that baby off. So that baby is truly latched. So you actually do need to release the latch before you actually, you have to release the latch before you do it. But there is such a thing. Sometimes babies don't get that. And they do kind of do this rubber nipple thing with you where I'll just know, like they're attached and something goes over and they just pull over. So they kind of just pull it away. So you have to be able to release that latch. So you have to actually, teach that baby that, when they want to come off, you release the latch and you manually need to release the latch and it won't pull your nipple so hard. And that is also true for biting. When babies get to be older and they start to bite, some moms stop breastfeeding, but you can teach your child that no, biting is not okay. And they do get it because they prefer breastfeeding to anything else.
Totally. Well, thank you very much. I so appreciate your time and expertise, and we are so grateful for our partnership and just everything you shared today. So thank you.
All right. Thanks for having me. All right. Bye-bye.
Bye. All right. So next up, we have an amazing mama of 7. Hello, Katie.
Hi, how are you? Good. Can you hear me?
Yes, I can.
All right. Wonderful.
You're one of my favorite people, and I'm just so grateful.
You're one of my favorite people, Nikki.
I'm just so grateful for you to share your time and your expertise. For me, everything that you do in baby-led weaning is so foreign. I think it's my unhealthy fear of choking, and I know when I hear it and I read your stuff, it's like I know that it's so mental for me to get past that. And Cece, obviously my good friend and sister-in-law, right? She did it, and to see it, it's one of the most amazing things. So I'm so excited to hear what you have to share today. And I won't take any more of your time or on your screen.
All right.
Here,
well, thank you. I'm going to Go
If you
ahead and
hit
switch over
share, I should
here.
have provided.
Yeah.
Yeah.
All righty.
Thank you again.
So, sure, no problem. Okay, can you see the screen there, Nikki?
Yes, we see it. So it's up there.
All right,
you might not be
cool.
able to, and you're on screen too, just FYI.
Okay, perfect. Well, thank you so much. And just remind me again when you want me to wrap up by, so I'll be concise here.
You got 12 to 15 minutes. You're good.
12 to 15 minutes. Perfect. All right. I'm going to walk you guys through the first 5 days of baby-led weaning. My name is Katie Ferraro. I'm a registered dietitian. I'm a mom of 7, and I specialize in baby-led weaning, which I'll teach you guys about today. You had a fabulous presentation there about breastfeeding. It's kind of a natural progression when you get to the 6-month mark. If you want to continue on with that responsive feeding technique that you'll all be employing or are with breastfeeding, baby-led weaning is a great alternate to traditional spoon feeding. So I run the largest digital community dedicated solely to baby-led weaning. I'm actually here in San Diego. I'll share a little bit about my home life just to start real quick. This is my oldest daughter at 4 months of age, Molly. I didn't know what I was doing. And around 4 months, our doctor said, why don't you start solid food? So I did. And Molly absolutely hated being spoon-fed. She rejected all of our efforts to try to get her to eat. This is actually my husband's hand trying to spoon feed her because I was like, I'm done with this. Like, she hated being fed. She hated food. I felt like she hated me. And I felt like this abject failure because what kind of mom can't feed her own baby? And then what kind of dietitian mom at that? So fast forward, we're at the height of our feeding frustrations with Molly. She's not eating anything. Meal times turned into this downright battleground. And we found out we were pregnant with quadruplets. Now, we had been doing fertility treatments, so the likelihood of multiples was there, but I was certainly not expecting quadruplets. And I remember thinking the first time I saw the ultrasound with the 4 babies, like, literally the first thing that went through my head was, how am I going to feed 4 babies at once when I can't even feed the 1 baby that I have at home? So the quads were born at 34 weeks, which is kind of a miracle if you know anything about high order multiple births. The average gestation for quads is 28 weeks with a 50% chance of major handicap. So I spent the entirety of my quadruplet pregnancy just completely mortified that we were going to have at least 2, if not more, severely handicapped children. And as a miracle, and thanks to the miracle of modern medicine, I ended up being able to go 34 weeks. And there's the first time I was holding all 4 of them: Charlie, Claire, Henry, and Dylan. We had 3 boys and a little girl. They spent the first few weeks of their lives in the NICU, growing and getting stronger. And you can see that they're all hooked up to tubes there. They were tube fed for a while. I was pumping like crazy. I never even attempted breastfeeding. I just pumped like crazy. They were all bottle fed. And they progressed and they did well. And I spent most of my time in the NICU stressing, though, about my older child at home. And I was like, when these 4 babies start solid foods, we need a different alternative than traditional spoon feeding because it was not working for us. So I did some research and learned more about baby-led weaning. I'm also a college nutrition professor. I teach locally here at San Diego State University in the Exercise and Nutrition Science Department. I teach at UCSD Extension and the University of San Diego. So I kind of leaned on a lot of my academic colleagues to learn about baby-led weaning. So when the quads turned 6 months at their adjusted age, we started solid foods with a totally different foray into foods than traditional spoon feeding. And with baby-led weaning, babies learn to eat age-appropriate foods that the family prepares for them, and you totally can bypass the traditional spoon feeding. And so I'll explain a little bit about that, but this is just starting solids with the quads. It was such a fabulous and life-affirming, life-changing experience for our family that actually shifted the entire focus of my nutrition career. And now I've been focusing exclusively on baby-led weaning for the last 5 years. So we went on to have one more set of multiples after the quads. We have a set of twins, Gus and Hannah. We had 7 kids, 3 and under for a while there. So it was just absolute mayhem. But I have to say that as crazy and psychotic as our home life was, not having to worry about picky eating, not having to stress about, oh my gosh, are they getting enough of the purees? Knowing that we were helping our 7 kids establish a healthful relationship with food was really, really, I think it alleviated a lot of stress. So in 2016, I created the 100 First Foods approach to baby-led weaning. So now I teach parents how to get their babies to eat 100 foods before they turn 1. It's kind of turned into this global phenomenon. We've helped tens of thousands of families get a safe start to solid foods all with this 100 First Foods approach. So I'm going to share the first 5 days with you guys today, a little bit about the program. If your baby is approaching 6 months of age and this is something that you're interested in doing, I'll tell you at the end a little bit about how you can learn more. But babies can eat so many more foods than we give them credit for, right? Oftentimes we think, oh, with traditional spoon feeding, babies have only had 10 or 12 foods by the time they turn 1. But with this approach in baby-led weaning, babies can have an infinite number of foods. And the reason why this is important is because those of you with older children likely know that starting in the 2nd year of life, all children will experience some degree of picky eating or food neophobia. And if a baby only has 10 or 15 foods and you lose those foods to picky eating, that becomes a very challenging child to feed. That's when you're at the pediatrician and asking for a referral to feeding therapy. And this cycle of stress with food begins and perpetuates itself. But if a baby has 100 foods under their belt by the time they turn 1 and you lose 10 or 15 foods to picky eating, no big deal. So I have kind of started this international phenomenon of the 100 First Foods approach. I speak around the world about baby-led weaning. I do a ton of social media, traditional media. I have a top-rated parenting podcast about baby-led weaning called Baby-Led Weaning Made Easy. Lots of resources for you guys to learn about how to get your baby to eat 100 foods before turning 1. So just as a real high-level overview, you see the picture of Molly there. That's parent-led spoon feeding. Whenever you see those long spoons and rice cereal and the parent shoving it in their mouth, okay, the baby we call that the traditional or parent-led spoon feeding model. It starts and generally stays with purees. And purees are an important texture for your baby to master. They're just not the only texture that your baby can eat. And the problem with traditional spoon feeding is that it ignores baby's autonomy. You learn all about breastfeeding and how a baby naturally knows when they're full and they turn their head away from the breast or the bottle. Why do we take that autonomy away from the baby at 6 months and pick arbitrary amounts of food to shove and force feed into their mouth? Okay. The problem with baby-led weaning is it tends to start too early before the baby is ready. Babies are not ready or safe to eat anything except breast milk or formula until they turn 6 months of age. So me starting at 4 months of age explains exactly why Molly hated it, because she was too early to be doing anything except breast milk or formula. Nutritionally, she didn't need it, and she wasn't physiologically ready to swallow foods yet. With the parent-led approach, or with the baby-led approach rather, which is BLW, babies have purees as well as other textures starting in the first week of solid foods. This approach supports their autonomy. We wait until they're 6 months of age. And then, as I mentioned, there's like an infinite number of foods. We focus on 100 foods, though, that the baby can eat before turning 1. Okay, so we end up with children who thankfully are starting to establish a healthful relationship with food. And that's one of the things I love about baby-led weaning, is because as a mom of 7 or a mom of anything or a caregiver or grandparent of other children, this is a lot of work, the food stuff, right? And I always remind parents of 6-month-olds, you've got to feed this kid for the next 17 and a half years of their life. Okay, so you might as well do the work now to help your baby establish a safe or healthy relationship with food. The key here with baby-led weaning, and I would implore you, no matter what approach you decide to take with starting solid foods, please do not offer anything except breast milk or formula until the baby is 6 months of age. The American Academy of Pediatrics reminds us that breast milk or formula is sufficient to meet babies' needs up until 6 months of age. The World Health Organization says the same, and that we start the weaning process from 6 months on. So when we do that, when you're ready to start solid foods in the first week of baby-led weaning, in my approach, we start 5 foods per week. So I'll show you a little bit about the math, but we do a fruit on day 1, we do a vegetable on day 2, a starch on day 3, a protein on day 4, and then a challenge food, which includes the allergenic foods. Because there's good research to show us that babies who are introduced to allergenic foods early and often, it helps prevent allergies down the road. And I know some of you might be thinking, well, my doctor says I need to wait 3 to 5 days between new foods to observe for any potential reaction. And I want you guys to know that that is categorically untrue. There's absolutely no reason, there is no research to support this recommendation that unfortunately a lot of parents are still hearing. We don't need to wait 3 to 5 days between foods. If a baby is going to have an allergic reaction to food, it will occur within minutes and up to no more than 2 hours following the ingestion of the food. So it's not like you let your baby eat a strawberry and then 5 days later, the diaper is different. You're like, oh my gosh, the baby's allergic to strawberries. That's not how it works. So I like to start with, I have a patented approach to starting solids called the purees for a few days approach. And we do this for parents who are scared or anxious about doing solid strips of food. Because with baby-led weaning, we offer the baby soft, solid strips of food about the size of your adult pinky finger. You can do that on day 1 if you want, but if you feel more comfortable pureeing, first we do a thin puree, which you see in the top left there. This happens to be avocado, which is a wonderful first food for baby-led weaning. There's a chunkier puree there, and then the traditional baby-led weaning strips of soft avocado. You can offer your baby purees and honor the self-feeding principles of baby-led weaning. We teach what's called a preloaded spoon approach, so that we're preloading the spoon with the puree, putting it in the baby's hand. Initially, you have to help guide the hand to mouth, but babies, usually by day 2, get the hang of it, pick it up, and can put it in their mouth. Okay, but you can totally skip the purees if you'd like to. Second day, we do a fruit, okay, or a vegetable. There's an example of bananas. Sweet potato, we want to be offering starchy foods. We don't need to do iron fortified rice cereal. We do naturally occurring sources of iron. So on day 4, I always do a meat. I like to do lamb. Actually, I was just working with a brand new 6.5-month-old baby yesterday. Day 4, we did lamb, soft, solid strips of shredded roast leg of lamb. We serve it with a lot of low sodium juice or broth. Moisture is important when we're feeding babies. You can puree it if you want to, but the babies love, they use that whole hand grasp, right? They don't get their pincer grasp until they're about 8 or 9 months of age. So using that whole hand grasp, they can pick the food up and bring it to their mouth. And then I like to do the first allergenic food on day 5. Yogurt, if your baby's exclusively breastfed, they've never had cow's milk protein, but it's very safe to eat cow's milk protein foods. So we can offer whole milk, which is full fat, no sugar added yogurt. And I know some of you might be thinking, well, gosh, do you only do 1 food a day? I'm going to show you, this is a video of Nikki and I have a mutual, my sister-in-law and her friend, Cece. This is her daughter, Jojo, at 6 months. This is her second day of solid foods, picking up those solid strips of sweet potato and feeding herself. Usually on day 3 is when we start a traditional plate. So let's say it's sweet potato, which is day 3. I'll give the baby about 10 minutes to try the sweet potato as the new food of the day. And in the second 10 minutes of that feed, I'll swap in a more traditional meal, like a plate you see here that is 2 familiar foods from the previous days. So avocado and banana from day 1. And then we're reintroducing the sweet potato there. That's on day 3. She's starting to see the familiar foods from previous days. And then we're moving forward with a new food each day. I generally don't do new foods on the weekend. The next week, pick right up, offering another fruit, then a vegetable, then a starchy food, then another protein food. Pork is a great one. We love to make pork shoulder nice and soft. And we make these lovely strips of shreddable meat that babies can safely self-feed. And then we do a second allergenic food. I like to start with milk and peanut, followed by egg. Those are the most common pediatric allergens. But within the first 9 weeks of solids, we want you to introduce all of the allergenic foods to your babies. So I help parents develop menus so that they can go through helping knock off these foods from the 100 first foods list, making sure they're getting the allergenic foods, trying all sorts of textures, getting iron from the meat foods. And at the end of 5 months, if you do 5 foods a week, that's 20 foods a month. In 5 months, your baby has eaten 100 different foods. And we usually have a big party and celebrate with the parents because it's such an accomplishment. A lot of parents will take a little certificate and put it in their baby's baby book. If you guys want to learn more about how your baby can eat 100 foods before turning 1, I teach a free online workshop each week. It's called Baby-Led Weaning for Beginners. All about how to get your baby to eat 100 foods before turning 1 without you having to spoon feed purees or buy pouches. You can sign up for this week's workshop times at babyledweaning.co. Got a lot of great information on my Instagram page. That's at babyled-wean-team. I link to my podcast there if you're more of a auditory listener. And for those of you who might have already started solid foods, if you're interested in learning more about how to make meat safe for baby-led weaning, next week I'm teaching a free 5-day mini crash course called BLW Meat Week. It's all about how to make 5 different meats safe for baby-led weaning. So it's a daily video training that I teach you about each meat, followed by a baby-led weaning recipe of the day. All over the world, parents are making these same 5 recipes next week We're doing beef on Monday, fish on Tuesday, pork on Wednesday, lamb on Thursday, and we're going to finish with turkey on Friday. So your babies will be ready for Thanksgiving with the family. That's blwmeatweek.com if you want to get signed up for free and to learn more.
I am dropping all of these links over here in the comments as well. Oh my goodness. I wish we had met when my daughter was younger. Woo, there we go. That is so amazing. Thank you so much.
All right. Well, thank you. Thanks for hosting this and for focusing on baby-led weaning. And if you guys want to learn more, I'm always available on that free workshop. I do a big Q&A at the end to answer any questions you might have about baby-led weaning.
Yay. And like I said, oh, my hair's a little crazy. We will be doing, we're going to repost this and we'll be kind of like transcribing a little bit of what you had to say and sharing information. Sure. So if you're happy to share the slides that you had in here, we can share bits and pieces of it as well.
Absolutely. Really always happy to share, and I'll share the links to Instagram's probably the best place to get all of the free training if you want to learn more.
And we're going to break up all of these clips as well and be sharing them on Instagram as well. So I'm super excited. So thank you so much for your time. I really appreciate it.
Thank you.
Thank you. Bye.
Bye.
Oops, I cut her off. Oh my gosh, my hair is so crazy. Anyways, thank you, Katie. Gosh, so amazing. Sleep. Is that such a foreign topic, I think, for new moms? At least for me, it was. It was a very difficult time, and I think that's very normal. But I'm definitely super excited to kind of hear what you have to say, because you're going to be talking about getting. I did the wrong thing here. Hold on one second. What are we doing? It's the sleep routine.
Getting the routine, yes.
Just in general, I wasn't sure if there was a time frame on that, so I wasn't sure. But, and again, I think there's a lot of just myths and different things, and when's the right time, and all of those things. So I think for me, even though my daughter still struggles with sleeping as a toddler, maybe you'll touch on that at a later date. But
yes, I'm going to focus. I'm going to focus on
newborns today. But yeah.
Yes, but I'm going to include some stuff that people can definitely use.
Oh, good. Okay.
As well. So I'm going to include everybody here. Okay,
yay. All right.
See here.
I'll
all right,
off and I'll let you take over.
Okie dokie. Okay. Share. We should be good. All right. Well, interrupt me if you can't see this, but my name is Lexi, and I am the owner of Little Bird Sleep Consulting. I work with families from the prenatal stage up to age 5. I apologize for how I sound. I'm recovering from a cold, so it's definitely reflecting in my voice. So I'm sorry about that. But I'm here to talk to you guys today about getting your baby on a sleep routine and about really baby sleep in general. Okay, so one of the most important things that I would like for you to take away during our time today is that I want you to take the pressure off of yourself and your baby's sleep, especially during the 4th trimester. So you're not going to spoil your new baby by rocking them to sleep or holding them for their naps. This is very, very, very normal. What we can do, though, is we can do sleep shaping. So sleep shaping is when we practice certain routines and behaviors that support infant sleep. I often hear people tell me, well, we're just not schedule people. We don't want to do the schedule thing. But in reality, like when baby is born, you're on a schedule no matter what. They're eating every few hours, 1, 2, 3, sometimes 4 hours, depending on what your pediatrician has worked out with you guys. But you're going to be on their routine. So in the womb, baby has a routine. They're used to when mom's active, when she's sleeping, her hips moving. So they have some routine, and then they come into the world and it's like, whoa, there's a lot going on. All right, so in the beginning, night 2 is notorious for a night of no sleep. This was very true for both of my children. Night 2 was just really, really rough in the hospital. And the first few weeks of baby's life are going to consist of feeding and sleeping literally on repeat. In the beginning, you're likely going to be holding baby for their sleep during the day, wearing baby, maybe pushing them in a stroller while they sleep. Most naps will be assisted contact naps. Now, sometimes babies struggle with day and night confusion, and this is when a baby sleeps all day and then they're awake at night, wanting to party at night. Light exposure can really help during the day with this, and it also helps for just like maternal wellness, just for your mood to be out in the sunlight. So definitely get a lot of light exposure, open the curtains during the day, don't keep all those shades drawn, let a lot of light into your house. And overnight, lights can actually disrupt a baby's sleep as early as about 3 weeks. So all babies are different. Some babies are in the potato stage a little bit longer than others. Um, but my son definitely, like by 3 weeks, he was, if we had bathroom lights on, he could tell. And then my daughter was more like 6, 7 weeks is when it kind of took her to notice lights around her during the night. But so if you have your baby in the bassinet next to you and you have bathroom lights on, hall lights, closet lights, the TV, you want to be mindful of these things at even this early of an age because it can disrupt them. I recommend that during night feeds and nighttime diaper changes that you try and keep the lights as dim as possible. So maybe some people use a salt lamp or a night light, or they just take their phone light and put it under a sheet and just, have as minimal light as you can, but you're still able to, feed and change your baby because we really want to separate like daytime, we have light, nighttime, we have darkness. Now, one of the first things we want to look at when we are setting up a sleep routine is looking at our sleep environment and setting up a good sleep environment to help facilitate a good sleep foundation. So, during night or sleep hours, we want darkness. Babies are not afraid of the dark, so don't worry about your baby being scared of being in the dark. Blackout or light filtering curtains are very, very helpful. Our children's brains start to produce sleepy hormones before it's time for sleep. We need melatonin in order to fall asleep. Okay, so light actually totally inhibits melatonin. So we really want to set the mood by dimming lights before bedtime. White noise machines are also very helpful. The womb is very loud. It's actually about 90 decibels. And for reference, that is as loud as a tractor. Now, of course, in the womb, you've got fluid muffling that intensity, but it is very, very loud. So babies prefer white noise to silence. White noise machines are, like I said, fantastic for drowning out day-to-day noises, and you want to use them for all hours of sleep. So don't worry about having to turn off the machine like halfway through the night or during a nap. That silence is actually startling. So definitely leave your child's white noise machine on throughout sleep. And then so also there are apps that you can download for you to tell the decibel level of your white noise machine. So you want to keep white noise machines in your room at or in your child's sleep space at 50 decibels and at a safe distance from their sleep space. So there's, like I said, several apps you can download. You hold it up to the white noise machine or where your baby is, and it can tell you kind of what the situation is. And then room temperature is also something we want to be mindful of. It's babies sleep best between 68 and 72 degrees. Now, it's also a good idea to consider using a swaddle or a sleep sack because these act as a sleep cue for the onset of sleep. And the AAP recommends that baby's sleep space is free of loose or plush items until 12 months of age. So a sleep sack or a swaddle is a great alternative to a blanket. All right, so working towards a routine. Around 6 to 8 weeks of age is a great time to practice placing baby down in a crib, bassinet, or pack and play for 2 of their daily naps. This will help them get used to their sleep space and napping independently. So again, this is really, really just practice. It's something to work towards. It's not something you have to master. It's just I recommend around 6 to 8 weeks we start introducing a really regular sleep space twice a day. Some naps are going to be very short at about 20 minutes or so, and some are going to be longer at about 2 or 3 hours. And during the day, you want to make sure that you're doing the best that you can to feed your child every few hours, depending on what you've discussed with your child's doctor. They're only going to give you one long sleep stretch in a 24-hour period. And you want that to occur at night, right? So if you have an 8-week old, and let's just say, they're giving you like a 6-hour stretch, with no feed, you want that to occur at night and not during the day. So we need to be waking our baby to feed them when, at that 2, 3 hour mark or whatever it is for your individual child. And sometimes it's very hard to wake babies, especially in the newborn phase. They're just feeding, sleeping, feeding, sleeping. But as they get a little bit older, they get a little bit more alert. And so you can use something like a wet washcloth or tickle their feet, remove clothing, whatever it is to help rouse them enough to eat and take a more full feed. So let's talk about signs that your baby might be showing you that they're ready to take a nap. These are called sleep cues. So babies tend to stare off into space when they are tired. We don't typically see this as a sleep cue, but it is a sleep cue. And then they might start to get red eyebrows. They might kind of clench their fists a little bit or fuss or rub their eyes. And then they're going to start yawning and then they're going to start crying. And if they're crying, we've really kind of missed. If they're crying because they're tired, we've missed that window for sleep. It's already too late. So you definitely want to get your baby down. But ideally, you want to have them down when they're like right between rubbing their eyes, fussiness, and yawning. When they're yawning, it's like we need to take action. Okay, so what is a routine? A routine is a sequence of actions that are regularly followed. All children, babies included, love to be able to predict what comes next within their day. Now, this is a great slide for you to screenshot, save, whatever it is, because I've outlined sleep. This is my sleep cheat sheet. Literally, I use this with clients. And it is a breakdown of, as you can see, sleep from newborn all the way up to when a child stops napping. So about 3.5 to 5 years. And this is like everything you need to know, a breakdown of daytime sleep. So on the far left, we can see that newborns are going to have a wake time of 30 to 60 minutes, if even that. And they're going to be taking little micro naps, is what we call them, all day long around the clock. And then around 2 to 3 months, we're going to have a little bit more wake time, maybe 30 to 90 minutes. And naps are going to be around 20 minutes up to a couple of hours. Around 2 to 3 months, I like to tell people to wake their baby at about 2 hours of sleep to feed them. And then at 4 months, you can say I actually have it broken down where there's wake times that are shown. And we start this at around 4 months because the circadian rhythm is developed at this time. Naps can still take, ideally at 4 months, I like to see like 2 longer naps and then 2 shorter naps a day. You could see here it's written out 4 naps. Um, but naps can take 4 to 6 months to really lengthen and get 2 longer, chunkier naps and then have those 2 shorter naps. And you can see on this chart that the wake times will lengthen and the amount of naps will decrease all the way until children drop their nap around 3 to 5 years old. So your baby is showing signs that they're tired, but how do you actually put them down to sleep? This can actually be, you think it's easy, sometimes it is, for other babies it's not. So Dr. Harvey Karp actually developed what's called the 5 S's, and it's meant to be kind of a bridge between the womb and the outside world regarding putting your baby to sleep. So your baby has shown their signs that they're tired, right? You want to implement then the 5 S's, which stand for swaddle, side, shush, sway, and suck. So you swaddle your baby. You're actually going to turn them on their side or on their stomach. And you kind of cradle them in your arms, almost like a football. And the reason we do that is because the human face is very stimulating. So if you have a baby who's tired trying to fall asleep and you're staring at them, they're not going to go to sleep. Your face is way cooler than going to sleep. So it's going to do the opposite of, soothe them. So you're going to swaddle, put them on their side. You're going to make a shushing sound or use your white noise machine. You're going to start swaying them or rocking them, and you're going to insert a pacifier into their mouth. And so the goal is that this, helps put baby to sleep. And then as they're used to this, you kind of can phase out the S's. You're able to maybe just swaddle them, put a pacifier in, and put them down, and they are, kind of awake, and then they just start to close their eyes. So as I get used to this, these S's start to dissipate. And these really do work, I promise you. All right, and another great way to get your baby on a sleep routine that facilitates minimizing day-night confusion and really lengthens nighttime sleep is to actually get them on an eat-awake sleep routine. So this method has been used by sleep experts for a long time, and it's actually designed to help with the feed to sleep association, and it promotes full feeds. Now, sometimes this will turn into a eat, awake, eat, sleep, and that is totally okay. You're going to be feeding your baby to sleep. That's, we kind of have this little taboo. It's not taboo. But keep in mind that it's nice to work towards an eat, awake, sleep routine to help with that feed to sleep association. Because we tend to see as babies mature in their sleep, they start to wake up needing to eat even when they're not hungry. So here's just a little sample schedule. You can see, 7 a.m., start the day, baby's going to be hungry, you feed them, then you spend a little time with them awake, and then you put them down to sleep using something like the 5 S's. And then, maybe you're on a 3-hour feed routine, 10 a.m., they wake up, they're hungry, you feed. And because they've just napped, they're going to take a good full feed. Okay, so in the evenings, there's often cluster feeding. Sometimes people do like 4, 6, 8 p.m., 10 p.m. dream feed, and then they might have some night feeds. And in those times where you're cluster feeding, there's definitely going to be eat, awake, eat, sleep going on. But what you can always do is when you're feeding and then you're moving to sleep, you can add an activity between, a little bit of an awake time, maybe a busy board book or one of those contrast books, something to engage your baby between the eat and the sleep portion. And then overnight, you're not going to have obviously wake time. You're going to be feeding your baby to sleep, feeding them in their sleep, dream feeds, keep them asleep as you can. That's totally okay. And then I find with an eat, awake, sleep routine, babies tend to drop night feeds on their own, which is really, really cool. Okay, and then this is another slide to screenshot and save. This is the daytime sleep needs by age for children. So newborns, we have 12 hours a day. They're going to be sleeping all day long, to be honest. At around 2 to 5 months of age, we are going to see about 4 to 5 hours during the day. And then 6 to 8 months, babies are moving from 3 to 2 naps a day. And they're going to be getting about 3 to 4 hours of daytime sleep. Around 9 to 13 months, they're still on a 2 nap schedule. We're going to see 3 to 3.5 hours of daytime sleep. And then 14 to 18 months, babies move from 2 naps to 1 nap a day. And they're going to be taking 1 long afternoon nap that's about 2 to 3 hours long. And then around 2 years, I see a lovely nap regression where children love to trick their parents into thinking that they don't need to nap. But I do teach families to implement quiet time as an alternative verbiage to nap time. And then ideally, they should be sleeping 1 to 2 hours during the day. And then around 3 years old, we start to see if a kid sleeps 2 hours, they're up till 10 at night and they can't fall asleep. So that's a great indicator that you might need to cap their nap at about 45 minutes. Some 3-year-olds still want an hour and a half of sleep and they still sleep 11, 12 hours at night. That depends on an individual child's sleep needs. But by 3.5, I usually see children need a 45-minute nap or they need to have no nap. Otherwise, like I said, they're taking a very long time to fall asleep at night. And it's common for kids to nap off and on until they're 5 years old. So,
Well, I wish
all
my
right. So congratulations. Congratulations to all you new parents. So I'm most active on Instagram. I'm over at Little Bird Sleep Consulting. So every Tuesday, I host a Sleep Tip Tuesday.
Uh-oh. Did we lose you? Lexi, are you there? We were just getting to the good stuff. All right, let's see. Maybe she'll come back on. But we are going to be giving away a 30-minute consultation with Lexi, which is absolutely amazing. And I'm not sure, we're just having some technical difficulties, but we did have a few questions in the comments over here. So hopefully when she comes back on, she can head over there and respond to those directly. Let's see, I'm just going to remove her from here because we are a little behind schedule anyway. So Lexi, if you can definitely head over, reply to those questions, we would be grateful. And I sure wish that my 5-year-old would take a nap. I need a nap. When do they implement naps in adult life again? That's what I want to know. All right. All right, so next up, I am so excited. We're going to go from kind of back to food and raising body positive kids. I think I love that Katie touched on just how important the relationship with food is and starting kind of a healthy relationship with food at a young age, even though that was a little bit different than what our next speaker, Riley Peterson from Raising Body Positive Kids, is going to speak on. Thank you so much for being here today.
Thank you for having me. Can you guys hear me okay?
I can definitely hear you.
Lovely.
And then Lexi, I saw you came back in the backstage. So if you can just definitely head over to the comments and reply to those directly, I would be greatly appreciative of it. And we are giving away that 30-minute session with Lexi. So head over and make sure you, if you're interested in winning that, post in the comments and drop any other questions over there. I will let you introduce yourself, but I just wanted to say I'm so excited. I think I am 5 foot, almost 11. My daughter's dad is about 6'3", and I think when I came across her, when we connected online, it was just so empowering to hear and get the tools that I needed to be able to kind of communicate with my daughter about, again, like people don't realize, like, oh, you're so big. Like, I hated hearing that as a kid. And like, again, like I want her to embrace her height and I want her to embrace her beauty, like those types of things. And so I know that might not be specifically what you're talking about, but I know that was where I really connected with you. So I'm so grateful for your time. So we're going to let you take it over with food neutrality begins at birth and how cultivating healthy relationships with food will help you raise body positive kids. So thank you.
Awesome. Thank you so much, Nikki. Hi, everybody. Thank you guys so much for having me here today. Really excited to be here, really excited to be chatting with you all. My name is Riley Peterson. I am a registered dietitian and I am the owner of Raising Body Positive Kids. Let me go ahead and get my screen shared for you all. Let's see. Give me one moment.
And then Lex, or Riley, are you on a Mac by chance?
I am.
Okay. So you would need to allow in your preferences Chrome to do a screen share. If you go to preference, you might even get kicked out and have to come back on to share.
Okay.
Or you could email it to me really quickly and I could pop it up when you could kind of start and I could.
You know what? That's okay. I'll just go ahead and chat with you guys if that's okay.
Yeah. No, sorry.
That works. I don't have too much information. If anything, it's just a good way to kind of get some of the info on a screen. I can share the slides afterwards, and I'll send you some links. So if you want to share some links with everybody here, they can access some of my content.
And like I said, we're going to recap and transcribe all of this too. So
beautiful.
All right.
No, I'll just go ahead and get started. Quickly, just want to introduce myself. Like I mentioned, my name is Riley. I'm a dietitian and the owner of Raising Body Positive Kids. Ultimately, I created this company with the one goal of just kind of helping provide parents the resources and information that they need to help cultivate healthy relationships with food, health, body image in their kids. Because I think we can all understand there are a ton of challenges that make it really difficult for kids to develop healthy relationships with food as they get older. We've got diet culture and social media, crazy, unrealistic beauty standards. Like Nikki mentioned, just kind of like lack of understanding on like what's okay to say and what's not okay to say. I felt it in myself growing up. And to be quite honest, I don't really know a whole lot of people who didn't feel these challenges. So friends, family members, strangers, my audience, they all kind of tell me the same thing. Building healthy relationships with food is really hard. Building healthy relationships with our body image can be really hard. And ultimately, we're starting to see this affect our kids as well. And it's starting to affect them earlier and earlier and earlier. So I like to work with parents to kind of nip this in the bud as early as we can. In this role, I kind of help parents reshape the way they feel, act, talk around food and size. Ultimately, it's my opinion that we can create new standards of beauty or I guess kind of expand the standards of beauty and kind of change the way that we talk about food and body image with kids, and hopefully create some more healthy relationships with food and body image in future generations to come. And ultimately, my goal as well is to kind of help parents heal some of those damaged and challenging relationships with those things as well. So I want to do two things today. I don't need to share these slides because it's pretty straightforward. I want to kind of discuss one kind of principle that I think is the foundation for building healthy relationships with food. And I want to teach you a couple strategies that you can use to get started using this principle today. But before we get into the how and the strategies, I want to talk about the what, this principle, and this principle is called food neutrality. And so it's a really interesting thing that parents can use to help teach healthy relationships with food, to avoid, any negative, charged, emotional reactions to food in kids as they grow up. Ultimately, it's really simple. It's the practice of removing food labels from the food we eat, right? So good, bad, junk food, superfood. Ultimately, our goal is to create as neutral of an environment around food as possible. So therefore, we're creating kind of an even playing field between all foods. So I recommend this strategy because I want to avoid teaching kids these charged associations that we can assign to food. The things that can result in emotional eating, food fixation, food aversion, guilt, shame, all those uncomfortable feelings around food. And I'll kind of give you an example of how this works in practice. So think about dessert, right? We all love dessert. We all, it's some of our favorite foods. Yet we also label it as junk food. It's bad for us. We shouldn't have too much of it. So when we pair these kind of two things together, this can lead to feelings of guilt and shame when we eat a little bit too much of it or have dessert too frequently. So instead, I'm trying to recommend that in kids, we create more neutral associations with dessert. So, rather than putting these food labels on food as we present them to our kids, we can just acknowledge and be neutral about it. So here's your dessert. We're going to have a little bit of it. We can explain that by saying, too much dessert can make our tummies not feel so great. And so here's how we can kind of build this relationship with food and how frequently we consume it on any given basis. But just tweaking this language here and there can really help us practice this essential idea of food neutrality. And it gives parents this kind of neutral environment for their kids to learn from. And so now, when it comes to the strategies of how we use this principle in practice, I know you are all new and expecting moms. Maybe you've had experience with kids in the past, but ultimately I know that this principle can feel a little foreign and unfamiliar to parents. And so I think it's awesome that we get to start as early as we can to practice this principle. So by the time that our kids are eating solids, communicating and using verbal language around food and listening to the language that you use, we've really become seasoned experts by this point. So now let's get into a couple of the strategies that I like to use and that I like to recommend to parents to use to practice this principle of food neutrality. The first principle, just as food neutrality is kind of removing labels from food, is the actual practice of removing the labels from our language, right? So the good, the bad, the healthy, and the unhealthy. And this is especially important for you new and expecting moms because it takes some practice. A lot of these words come to us very subconsciously, and we just are so used to labeling foods and kind of putting them into these individual boxes. But in reality, when it comes to food, there are good and bad sides to everything we eat, right? All foods ultimately can fit into a healthy diet. And I think sometimes this gets a little lost on people. We get really focused on wanting to eat healthy and clean. And we want to make sure we're not eating too much of the junk food, the bad food. But ultimately, that's eliminating that principle of food neutrality. So if we kind of put foods all in the same playing field, we remove those food labels, we consider health beyond just our physical health, but we also consider our emotional and social and mental health. This can kind of help us put this into practice. And you have plenty of time now to practice that strategy, removing those food labels from our language. So by the time you're explaining these, these kind of trends of eating, we eat lots of fruits and vegetables, we don't eat so much dessert and high sugar foods, then we can kind of, already have practiced the fact that we explain the why versus just labeling them as black and white. And so this is a really straightforward way of kind of practicing food neutrality. A second strategy might come a little bit later, but ultimately you can continue to practice that, this skill as your kids grow up. I know if you listen to Katie Ferraro's presentation today, you're probably already kind of tuned into this idea, but you can also practice food neutrality by exposing your kids to a variety of foods as they start to learn how to eat. This is important in practicing food neutrality, and it all comes down to your poker face. So when you offer 100 foods to your kid in 100 days, you want to make sure that you're offering all of these foods to your kids with the exact same energy. So broccoli gets the exact same energy as yogurt, as does maybe a chocolate chip cookie, as does maybe, beef or pork. All of these foods are going to get the exact same energy, no matter how you kind of rate them on the scale of healthy or unhealthy. And so, it's also important to consider this when your kids react to food. So if your kid doesn't like a food, don't react. Keep that poker face going. Just acknowledge it and move on. If they love that food, same thing applies. Poker face, acknowledge it, and then move on. You want to kind of create that neutral energy around food, and the way you react to food and the way that you present food is going to play into the way that your kid learns to associate foods with certain feelings. So you want to avoid any strong reactions in response to their food, and this will help create that neutral environment for them to learn from. It will also kind of give them some more autonomy and independence in the relationships with food that they start to form early on. And last, while this isn't really necessarily a food neutrality strategy, it plays into reinforcing body positivity and the way that our kind of relationships we build with food and the way we feel about ourselves are kind of interrelated. One of the most important things that I can recommend to parents and new parents is to understand that, kids hear everything we say, right? And so to teach body positivity and to reinforce these ideas, I think it's really important for parents to be careful about the language they use in front of their kids, especially when it comes to things like size, appearance, diet, and weight loss. Totally normal for sometimes us to just make a comment, oh, I don't like the way I look in these clothes, or, oh, I could use a couple, lose a couple pounds here and there. We say it out loud. We don't think too much about it, but sometimes our kids can catch on, right? And so we don't want to teach our kids to normalize these negative self-talk behaviors, the dieting, the attempted weight loss. Ultimately, if we're not too careful, these behaviors that kids learn can escalate pretty quickly. They can potentially lead to some disordered eating patterns. And that can, that's something we want to avoid, right? And so trying to prevent them from learning these behaviors in the first place is a really important way to teach them body positivity and body neutrality as well. So just being neutral about their bodies, as well as the way they talk about and interact with their food as they grow up. So it's important to keep these comments to ourselves if we can. It's also important to avoid these comments about others around your kids. So these comments can easily slip out. You don't like that person's outfit. Maybe they've got a funky haircut going on, and maybe you don't even mean it negatively, but you do comment on someone else's appearance. Just like we want to avoid exposing kids to our negative self-talk and weight talk and diet talk, we also want to avoid teaching them and exposing them to talking negatively about others. So research shows that kids as young as 5 years old are starting to demonstrate biases towards others based on size and appearance alone. And so we have a responsibility as adults to do what we can to prevent these biases from forming and to kind of give them a more positive or a more neutral even environment to learn from. And we can do that simply just by keeping those comments to ourselves. And again, as new and expecting moms and parents, we can really start to practice this early. So by the time our kids are able to notice, we are seasoned experts. And these are some of the really straightforward ways that we can prevent this from happening.
I think you nailed that one when you said, I think a lot of that has to do with us, right?
Yeah. Oh, absolutely.
It's not so much. Yeah. And I didn't mean to cut you off there. But
that's okay. No, I was just gonna wrap up by sharing, if you want to learn a little bit more, I will drop my contact information so that way you are able to access those links. I'll send that to you right now, Nikki. But ultimately, if you want to learn more from me, you can visit my website. It's balancelifenutritionconsulting.com. I also have a free digital guide if you want to learn more about food neutrality, creating a food neutral household. I'll also drop that link, and you can find me on Instagram at Raising Body Positive Kids.
Yay. And I promise you will not be disappointed. Sign up for her emails too. I hate emails. I get so many of them, but I take the time to read yours. And I can't tell you, I think obviously it's personal because of the situation effects of even I had to take a hard look at myself after reading through some of your content and things that you had, these kids don't just come up with this information. They're getting it from somewhere, and it's likely from us. So we all need to take a hard look at what we are saying, whether it's I just don't even like this shirt, or, whatever it might be, just little things. I've really changed how I talk about myself, and I can see a difference. And then there's also just those external factors that I'm still working against, but it's definitely made a huge difference. So thank you.
Oh, thank you, Nikki. Thanks for having me too. It was great to be able to join you all today.
And we did drop websites and other information in there, but definitely the guide. I think send that to me and I'll put it in the comments, and then we will be doing it again. I'll be breaking apart all of these videos by each speaker with a little recap, transcription, not word for word, but highlights and big points. So, and obviously links where you can learn more. So thank you very much. All right. Thank you. All right. So last but not least, we have Fit for Mom on deck here. I'm going to go ahead and bring her in. Christina. Yeah.
Hello.
Thank you so much for being here.
Yeah, thank you. My name is Christina. I'm with Fit for Moms San Diego. And if you've never heard of us, we provide classes for moms in all stages of motherhood. So whether you are an expecting mom, a mom with kids who are stroller age, or if your kids are older, or you just want that mom only kid-free workout, we have classes for you, and we are all throughout San Diego County, so you can check us out. But today I'm here to do a quick demo of our Fit for Baby class. So this is our class for expecting moms, and it's an amazing class to celebrate this exciting time in your life and have you help you to connect to yourself, to your baby, to your instructor, other moms in the class, and we not only have the workout, but at the end, we end class with a meditation or like a reflection to help you connect even more to what's happening to your baby and to yourself. So if you want to work out with me, I'm going to get my timer on, but if you want to work out with me right now, you can grab a resistance band if you have one, but if you don't have one, no problem. I will tell you how to create that resistance on your own. But we're going to take one foot, tap it in front, out to the side, then behind us, and then bring it right back together. And then do that on the other side. So just a quick warm up here. Nice job. And normally at the beginning, we'll connect to our breath a little bit here, but we're just going to get into the workout today. Nice job. And in our classes, I'm doing about 2 rounds, shortened rounds of work in class today, or in this demo today. We're going to go into some hip circles. But in our class, we go through 4 rounds of cardio endurance, strength conditioning, and standing core balance as well. So you can switch directions with those hip circles. Check in with how you are feeling today. I know that can change depending on the day of the week, the time of day even. So we are really here. All of our classes are really there to meet you where you are, how you are feeling that day and at that time. So we have lots of different options for everybody. Right here, we're going to take opposite knee and arm up. Nice job. So again, if you have a resistance band, you can grab one. If not, no problem. And then if you have a mat too, we'll be on the floor. So if you don't have carpet or something nice and cushy below you, you can do that. And our Fit for Baby classes are great for all stages of pregnancy as well. All fitness levels. It's a great total body class, focusing on your breath, stability, mobility, all those things you will need for pregnancy and beyond. Right here, we're going to go lift one side and then out to the other, like your little pendulum here. But we're going to go into our first cardio endurance move in about 30 seconds. I'm going to pick up my band so it's with me and close to me the whole time. We're going to start with some low jacks. So right here, you got a slight bend in your legs. Arms are about 90 degrees the whole time, and you're doing a jack right here. So making sure your belly is supported, your core is engaged. If that is not comfortable, you always have that option to take it to that more upright position right here. You can take it a little bit faster, and if it is comfortable to you, you can add a little hop here. Again, if you want to do that standing, you can do that. If that does not feel good to you, by all means, stay right here. So we want to make sure we don't get breathless. We should still be able to say a sentence at a time, 3 to 5 words at a time. Nice job. We're going to go into our first strength move. So I've got my band. I'm going to wrap it around my hands. It's going to be right in front of me. My right leg is going to come back for a reverse lunge, and then my right arm is going to come behind me. So nice low lunge. And again, remembering posture is key. Especially during pregnancy, we always want to kind of curve in a little bit or stick our pelvis out. Want to make sure everything is nice and aligned. Shoulders are down and back. Chest is lifted. We hunch over all the time. Right here, you can take it to 2 arms for these last few seconds. Right, in pregnancy, in motherhood. So we want to focus on that posture. Pulling those shoulders down and back. Last one here. I'm going to take my band in one hand. We're going to reach over to one side. As we come out, we're going to lift that leg. So my right arm is just doing a slight reach. I come back, my right leg comes out. So this is our core balance section. Having a strong core is super important. All of our core balance exercises are standing. Our life happens in a vertical position. So we work here on a neutral pelvis. Everything is aligned. Woo, nice job. Safely challenging our balance here to adapt to all of the weight distribution and shifts that happen during pregnancy. We're going to go back to that low jack cardio in 2 and 1. Right here again, low jacks. If this doesn't feel comfortable, take it up a little bit higher. Building in intensity here depending on how you feel. Again, we never want to get purposefully breathless in our exercises. So we talk about the talk test a lot, being able to say a sentence, 3 to 5 words. If you want to take it up to high impact right here with the low jacks or high jacks, you can. If not, remember, staying right here. Woo, nice job. Always giving you those options so that you can decide what feels good to you that day. 2 and 1. We're going back to our strength move. So move right along. We take a nice little pause at the end of each round. This time our left leg comes behind us, and then our left arm comes out to the side. Again, chest is lifted. 2 90-degree angles if you can with that lunge. Woo, focusing on our posture. Head is right on top of our shoulders. Shoulders over our hips. Nice job. If you want that option, make this a little harder with the resistance band to bring both arms out. You can. Keep breathing here. We're going to go back to that standing core move on the other side. In 2 and 1. Nice job. Left arm coming overhead. Come back together. That left leg is going to go out. Nice job. Making sure you're standing nice and tall. Your core is your power center. It generates that stability and mobility for movements that are important in life, in pregnancy, in motherhood. Core is engaged, zipping up through that pelvic floor. Nice job. You can have one hand on your belly here if you want. Giving your baby a nice big hug. Beautiful job. We're going to take a quick break here in 3, 2, and 1. So this is our time. We take a break between each round, chat amongst the moms, check in with each other, see how everyone is feeling, and then we're going to go right into another cardio move. So this is our round 2. Let me fix my mat. Right here, we're going to go to a squat and a knee lift. Squat and a knee lift. So again, how are you feeling today, right? Again, it changes so much. So if you need to take that squat a little bit more shallow, you can. If you could want to take it a little bit deeper, you can. Adjusting your knee lift for that beautiful baby belly in front of you. And if you want to take it a little bit faster, maybe even add a little hop at the top, you can do that too. But if you want to stay here, stick with it right here. We're going to grab our band, do another strength move in 3, 2, and 1. Nice job. Grab this band here. I'm going to turn to the side. We're going to step on it. And if you don't have a band, just create this resistance on your own. So lead with your booty. Hinge from your hips with a flat back. We're going to row and extend to work our triceps and then stand back up. So lead with your booty for that deadlift, row, and tricep. Remembering when you stand up to keep a nice neutral spine, neutral pelvis, so we're not arching at the top. Woo, nice job. Keep it going. We are slow and intentional with our movements. Beautiful. We are going to go into our core move, into, and 1. I'm going to turn back towards the front here. Right leg taps in front. You're just going to lift and lower your leg. Again, core is engaged, hip up through that pelvic floor. If you want to challenge your balance a little bit more, you can bring your biceps up by your ears. If not, they can be down at your hips. You can even hold on to something if you need to. The key here is making sure you have a nice flat back. So again, we're bracing our core. We're engaging our core. So we don't want this move to come from our back. We're just lifting like we have a wall behind us. Lifting and lowering. 2 and 1. Nice job. We're going back to cardio. Are you ready for it? Squat, knee lift. Wherever you are, remember, going back to that talk test. We don't want to get breathless in this workout. We should still be able to say a sentence, 3 to 5 words. If I were to come up and ask you a question right now, you should be able to answer me. Nice job. You want to take it a little bit faster? Go for it. Again, adjust that knee lift, adjust that squat for that beautiful belly you've got. If you want to take it up and add a little hop at the top, you can do that. If not, just stay right here. You're almost done. We're going to do those deadlifts again. Into and 1. Nice job. I'm going to turn the other direction so you can see the other side this time. Standing on your band. Again, if you don't have a band, you can just create this resistance on your own, but lead with your booty. Protect your belly in front. Row, tricep, and then stand up to that neutral position. Beautiful. I hope you're getting maybe you're getting a little sweaty if you're working out with me right now. Nice job. We're going to do those leg lifts on the other side. Remember here, we focus on intention over intensity in this workout. 2 and 1. We don't need our band anymore. It can go to the side. We're going to do those leg lifts on the other side. So left foot taps forward. You lift and lower. Again, this is your powerhouse right here. If you're feeling that balance today, you can bring your arms up overhead. If you need some assistance, go for it. Hold on to something. But remember, nice and tall here. Everything is aligned. Everything is stacked. So if you find that you're getting that curve as you lift, just take that lift a little bit lower. All right, we'd rather have building that strong core and have that great alignment and your leg lift a little bit less than having that arch in your back and not working on that core. 2 and 1. Nice job. We're going to do a little cool down here. So I'm going to turn to the side. So we really focus on transitions in our class from standing to sitting to kneeling, just because weight distribution, we got baby bellies, all of that. We want to make sure everybody is safe. So to get down to the ground here, we're going to take 1 foot behind us. I'm going to push both hands onto my thigh, and then I'm going to bend here until that knee touches. You can bring one hand down, or you can sweep that other leg around, and you're going to come to all fours here. We're going to alternate a bird dog here. So opposite arm and leg go out to the side, or go out in front. And again, working on our mobility, stability. We call this our birth prep section. So really focusing on strength, mobility, all those muscles we will need for birth and beyond. Nice job. We're going to come up to a kneeling position here. I'm going to turn to the front so you can see me. We're just going to do little monkeys right here. In a kneeling position, just reaching down. Nice job. Nice and gentle movement here before we go to a seated position in a second. Ooh, keep going. Strengthening that core. Nice job. With these ground movements, again, being intentional, learning how to load and unload our body to any position we need so we are safe. Beautiful job right here. I'm going to bring my hands down. I'm going to move one leg back and then come to this seated position here. You can sweep your leg around. If you want, you can have the bottoms of your feet touching. If that is not comfortable, you can come to a seated position. Right here, we're going to bring one arm across. And then we're going to switch to the other arm here. And again, like I said, we end each class with a little reflection or meditation. So really quickly, it's a little bit longer in class, but really quickly, just to finish us off here, I want you to end with one hand on your belly and the other hand on your heart here, and start taking some deep breaths. And as you inhale, you can relax your belly, you relax your pelvic floor. And then as you exhale, engage your core, draw it in, lift from that pelvic floor. And a few more inhales and exhales. Being mindful and appreciating any movement you feel in your belly right now. Appreciating this moment, this time that you have taken, that you've carved out for yourself to take care of your body, to take care of your mind, of your baby, to learn more about all of the amazing things that you've learned about today. Inhale and exhale, and in your mind, I just want you to give your sweet baby a big hug. Feel all of those warm and fuzzy feelings. And then you can release right here. We're going to do one more inhale. And exhale. You can bring your hand heart center, and every class we end with saying, and your most important stretch is your smile, which is so true. Thank you so much for joining me today for this Fit for Baby preview. Like I said, we have classes all over San Diego County. Our Fit for Baby classes, stroller strides classes, stroller bar. We have so many different types of classes for moms in all stages of motherhood, all fitness levels. And like I said, we really meet you where you are. We have moms come to stroller strides. You know how it goes. You chatted about sleep. Maybe the sleep does not happen, but you need to get out of the house. You need to talk to other moms, get some fresh air. We are always here for you. Like I said, every stage that you are in, all levels, we have something for everybody, and just really great support groups in our moms and our classes. And it really is a truly amazing thing. And we'd love for you to check us out. We'd love to see you in class.
I love it. And we did have a few questions, if it's okay, really quickly.
Oh, yeah.
So what is it? So with the Fit for Baby, so I, for example, also had a C-section, but she's asking if there's a C-section mom, is the Fit for Baby probably the first step in the process of going back to work? And obviously get clearance from your doctor, but is there a time frame maybe with the C-section too that you're aware of?
So Fit for Baby is for moms who are expecting.
Pregnant.
So,
okay.
Yes.
So that was another question.
No problem. But when it comes to like our stroller strides classes and things like that,
that's the first one.
Yes, definitely talk to your doctor. That would be like the first time that you would come with your baby. But definitely talk to your doctor, especially after a C-section. It's normally a little bit longer than it would be. But of course, your doctor would know. But pretty much once you get clearance from your doctor to start moving and exercising again, that's when we would love to see you in one of our stroller-based classes.
So stroller strides is the first kind of segue.
Postpartum. Yeah. Mm-hmm. Yeah. So you can start stroller strides as soon as you feel good and get that clearance from your doctor. And of course, once you're there, listen to your body, make sure you're feeling good and all of that. Yeah.
Totally. No, I absolutely loved it. I did stroller strides, and I think you guys just keep innovating too, and adding classes and the bar. You guys just keep doing such amazing things. And it's all designed for new moms, expecting moms, and it's really
for new moms and beyond. Like I said, we have mom-only, kid-free classes if you want. I
did the mom-only ones too.
Oh, you did?
Our body back, body. Yeah. Oh my gosh, they were so hard.
Yeah, those are great. Like I said, all levels are welcome at all of our classes, and it's really great. I always say it truly did change motherhood for me once I joined, especially right now. Maybe there's not as many events going on and things like that. It's always great to get outside, to meet moms, to watch your child form relationships with other kids as well, and truly. It sounds corny, but it really literally life-changing for me and so many other moms. What?
I said you became an instructor, so I mean,
I did. So literally,
I love that. Yeah. But I mean, you hear that, I think it's such a recurring theme. Like I had actually looked at franchising Fit for Mom up in Oregon before I moved down here, and it's such a great opportunity. And it's like, honestly, like the tribe is really incredible. And I'm so grateful that you guys are based here in San Diego too. So to have that support, and grateful for your time. So thank you very much. Appreciate it.
Yeah. Thank you for having us.
And we posted all the links and schedule classes. And if you have any other questions, drop them in there. We'll make sure that you guys, at least if we can't answer it, we'll get somebody that can.
For sure.
Thank you.
Absolutely.
I appreciate it.
Thank you so much.
Bye. All right. Well, gosh, that was so much information, such amazing resources and experts in their fields that took their time out of the, busy Saturday, whether they're working or not, or we're at home. Really incredible just to, have them and have them donate their time to share this information. And so what we really plan to do with all of this, which is a little bit different than what kind of our typical Bloom event is, which is in person, is to really break down maybe each speaker, where we could have that in shorter clips, transcribe and really kind of share the information in word form as well. Because for me, sometimes I don't have time to watch a whole video, but I want the highlights and I want to know what's happening. They provide links and resources connecting you to these individuals who donated their time today, because they're all absolutely amazing people. And I think that's one thing that I love about San Diego Moms, and really what it is, I go to the super dentist, I go to CPCMG, these aren't just partners that we use, online, and they're connected to me personally in lots of different ways, and to all of our writers and to the family and the communities that we service. So thank you again for being here. Thank you again to Children's Primary Care Medical Group, our presenting sponsor for this event. We are so excited to be back in the spring. Hopefully, gosh forbid anything horrible happens, but we will be back in the spring in person, same speakers, a lot more opportunities to have hands-on interactions with businesses that make products, products and kind of all of the samples and all that fun stuff that go with this event, weren't here. We did offer some giveaways, so we'll be reaching out to everybody individually if we haven't done that already. And thank you so much again. I appreciate it. Have a great day.